Good afternoon. Thank you for inviting me to the Allied Health Workers Conference. My name is Nadia, and I'm a speech pathologist supporting the communication skills of children with Down syndrome. Let's get started with some facts and figures. Down syndrome is a genetic condition and the most common cause of mild to moderate intellectual disabilities in children around the world. Around 1 in 1,000 babies in Australia are born with Down syndrome each year, and this is due to an extra or partial copy of chromosome 21, which changes how an unborn baby's brain and body grows. About 95% of children have a type of Down syndrome known as trisomy 21. Less common forms include translocational and mosaic Down syndrome. Now, children with Down syndrome often have distinct facial features, a flattened face, almond-shaped eyes, small nose, and a protruding tongue, and may have other medical conditions such as congenital heart disease, hypertonia, and ear and eye infections. Now, anyone can have a child with Down syndrome, and researchers are yet to determine what causes the error in cell division to create the extra or partial copy of chromosome 21 to occur. While a diagnostic tests are available before birth to confirm a diagnosis, no test can confirm the impact that Down syndrome will have on a child. That's why it's really important to remember that every child with Down syndrome is unique and different with their own strengths and challenges. You may work with two children with Down syndrome and notice that one is speaking in short phrases while the other is using sign language and gestures to communicate with you. Every child with Down syndrome will have a different mix of therapists to support their development because their cognition and physical differences make it difficult for them to learn, process, and access information. Speech pathologists, we work to support their language and speech skills so they can express their needs and wants, as well as develop social skills to make friends. Children may work with a physiotherapist if they have low muscle tone to improve their mobility so they can learn to sit, crawl, walk, and be physically active. Occupational therapists can develop a child's fine motor skills to help them achieve greater independence on daily tasks and learn skills for playing with friends. Now that we know a tiny bit about Down syndrome, how does this condition impact their quality of life? So advancements in medical treatment have significantly increased the life expectancy of people with Down syndrome from 20 to 60 years. Yet adults still experience discrimination and lower quality of life because they want relationships, independence, self-determination, and participation. A recent study reported that teenagers have a lower quality of life perceived by parents compared to children who have a higher IQ, better reasoning and social skills, adjusting abilities and behaviors. And this is fascinating because it suggests areas for future intervention. As quality of life varies throughout the different life stages, we need intervention that talks to who they are, what they want to do, and what can facilitate these opportunities beyond the medical and social model, but also think about environmental and personal factors. So let's look at supporting communication for people with Down syndrome. This is a great template that you might like to reference to think more holistically in practice about the many factors that may prevent participation for a child with Down syndrome. So here's Lucy. She's a 3-year-old girl. She has a small mouth and protruding tongue. That's a body impairment. And that makes it difficult for her to ask for a toy when playing with her friends. There's the activity and participation limitation. Her friends are unaware she's trying to communicate, and her busy teachers have not received training or education to assist her, which are both environmental factors. This situation is making Lucy upset, which is a personal factor. So here we can really see that the IVF really guides ways for us to improve inclusion and support for Lucy by going beyond her physical, mental, body structure and impairments. Children with Down syndrome will have language difficulties because their cognition, such as attention and memory, are delayed, and we need these to learn language. While every child is different, children with Down syndrome will have better receptive skills, what they can understand, more than they can say to express their needs and wants. We use the child's strengths to build their language skills with their families. So, for example, a child may have a large vocabulary using gestures and facial expressions. So, signing is a great way to communication, or using visuals can be a great way to prompt them to express their needs. In a session, ask a parent or a carer how can their child express themselves or like to express themselves, and be open to using visuals and gestures to facilitate therapy participation. Children with Down syndrome often have delayed speech and say their first word around 2 years. They may also speak in short sentences due to muscle weakness. We recognize the differences in their mouth and assist them to make the sounds they need for speech. Again, visual pictures, because of their strong visual spatial processing, can help them express themselves when their speech is limited. You can also allow for plenty of time for them to respond, paying attention to their facial expressions and gestures and cues in your sessions. Every child with Down syndrome is different, but together we can focus on nurturing their skills to aid participation and quality of life. Thank you for your time.